Hi, my name is Kelly Curan. I'm the Director for HIV, AIDS, and Infectious Diseases at Jhpiego, and this is my colleague Tigistu Adamu. He goes by Tiggy, and he is the team leader for TB and HIV at MCHIP. I'm going to be talking with you today about a program in Mozambique that has greatly expanded access to HIV testing and counseling and to other health education services. This program started quite a number of years ago now when the results of a big population-based survey came out in 2003, which found that only 3% of adults in Mozambique had ever been tested for HIV. So meaning that 97% of Mozambican adults didn't know their HIV status, but yet this was one of the highest HIV prevalence countries in the world. And so we met, Jhpiego team met with the Ministry of Health and the National AIDS Council and our donor, which is the CDC, with PEPFAR funds, to kind of brainstorm what could be a possible response to this problem. At the time, HIV testing and counseling services were available, but only in health facilities. And so some people were coming, but as you could see from the results of the survey, it was only reaching a very small percentage of the population. So after a series of meetings, what we decided to do was to work with a group of local NGOs and faith-based organizations to do a pilot project testing whether community health workers could do HIV testing and counseling in the community, actually at the household level. And so we worked with these local NGOs to train a group of community health workers. They had been doing HIV prevention activities in their communities, but most of them, they were not health professionals. On average, they had a 7th grade education. But we trained them to provide HIV testing and counseling using rapid tests at the household level. And then the Jhpiego Mozambique team provided support, training, support, supervision to make sure that they were doing things the right way. And what we were very pleased to see at the end of the pilot period was that not only were they good counselors and they were good testers, so their testing accuracy was excellent, but that the acceptability of testing at the household level was really high. So one of the things we'd been wondering was maybe people just don't want to know their status in Mozambique. Maybe that's why only 3% of people are aware of their HIV status. But what it turned out was that people just didn't have access to testing. And when you brought the testing into the home and you could offer it in a private, confidential, kind of a safe place at the household level, the majority of families actually chose to learn their status. And so this program has since expanded greatly to, involve many more church groups, Islamic groups, and other community-based organizations. It's now working nationwide in every province of the country, and to date, more than 900,000 Mozambicans have learned their HIV status as a result of this program.
So now I will be talking about PMTCT. 30 years into the HIV pandemic, we still have children getting HIV born in Eastern and Southern Africa. Today I'll talk about the experience we've had in Kenya, in a province called Nyanza, in a district, Bondo, which has one of the highest HIV prevalence amongst women, and of course a number of children getting HIV and acquired it during birth. So in Bondo, the context is as such that many women who are HIV exposed or who are HIV positive do not get access to come to health facilities and get services as needed. And most of the community members do live very far from health facilities. So one of the interventions we've had in place was to train a number of community health workers to bridge this gap. The community health workers go out to the communities and identify where these pregnant women live and try to make it easier for them to access as well as utilize services in health facilities. Through this intervention, within a span of 12 months, we were able to increase the number of women who come to health facilities and access ANC services by 100%. We doubled the number of women who do get HIV testing in facilities, and we even tripled the number of HIV-exposed infants who get HIV testing within 6 weeks after birth.
So let me talk with you now a bit about some of our work in voluntary medical male circumcision in Tanzania. This is a program with MCHIP, and we are working in a very remote area of Tanzania. to make sure that men in this rural region have access to this service, which will reduce their chances of contracting HIV by at least 60%. But in this setting, many men live very far away from health facilities. And so every year during the cold season, after the tea harvest, there is a campaign that is held whereby services are brought to the most peripheral level of the health system, to the health dispensary, which is even smaller than a health center or a clinic, but also services are sometimes brought even to temporary structures. So for example, at one point the team was doing an assessment and they found this old marketplace that had been abandoned. And so there was a great space that was available. It was covered. It was really well situated where a lot of men could access the service. And so they worked for several days to turn this abandoned market structure into a male circumcision clinic, where the counselors could come in and offer education, counseling, HIV testing, and then the surgical teams could provide the service. So as a result of all of this effort in Tanzania, we're really proud that the MCHIP program has helped the Ministry of Health of Tanzania reach more than 150,000 men with male circumcision services.
So like we've seen in the 3 different interventions that Jhpiego is involved, bridging the gap between community members and health facilities is very important. The involvement of community health workers improves the quality and utilization of services in many of the facilities we support.